Okay, good morning, Sabrina. Good morning, Chris,
There's a
Jason.
good smile on your
Anyway,
face now that you're getting the tier. You saw the tier one, the tier twos, and you're finally going to get some money. Right.
uh, it's not, it's not, we have to ask Gita, and it's not just tier one, tier two, but its own clinic in Guam.
Right.
Every provider. And we need to ask Gita what the criteria for any clinic to be able to get reimbursed from the federal in order for them to continue to protect their staff and continue to provide care for the people of Guam. So it's not for tier one, tier two. Lots of clinics have spent a lot of money on PPE in order to protect themselves
Right.
and do other stuff in the clinic. So Gita is a very good way for this thing to go through because there's transparency and then we actually have to turn in the expense, everything, so to get reimbursement. So this is a cross of all the clinic in Guam and not just tier one, tier two. It's just that we are just to tier two, a much bigger clinic, so it's more visible. But that's for everyone in Guam. So we got to get some guideline from Gita in order for us to pass out all the clinic. So I'm happy, because so far, um, I don't think none of the healthcare provider in Guam have been reimbursed for their um, for this whole pandemic and on taking care of the patients. So I'm glad that the governor decide to do that through Gita. So it's very, very good for everyone, the healthcare provider in Guam.
Right.
Yeah, but I think Mr. Bunn said that $2 million in CARES Act funding, that's how much is going to be set aside. Is that really enough?
I think, Sabrina, anything would help because, I tell you, none of the clinic I anticipate this, and as you know, even the PPE and the supply, they become quite expensive.
Right.
Probably 3-4 times more expensive than it used to be. So it's very hard to purchase all these things. Just like for us, every time that we have a positive case coming through our clinic, we change everything. All the PPE is gone. So. We need to replace them. So your supply go away pretty fast. And they're not cheap anymore. So.
Right. Well, good luck.
Yeah. So we're gonna need that, but I think that it's a process that at least we have something that we can put the heads on. So it's a one step forward.
Yeah,
in
it
the right
just
direction.
seems like this has been, we've been in 6 months and we're just now talking about
The
payment.
clinics. Yeah. Weird.
Because I remember the GMA meeting and it was like the governor said that, she can take control when a public health emergency is declared. She has the power to basically tell all, she owns the clinics, basically.
Well, it's better late than never, and like I say, our sole purpose now is that, we just move forward, and from day one in March, our regular things we got to take care of people first, and that's what we did. So, we didn't push for any money because it's a very long time to do. From when in case of emergency, like I say, we service the people first, and we worry about the money they.
Right.
That's.
So, Doc, let me ask, getting reimbursed, what can you give us like a ballpark figure on how much you think some of these clinics are owed for reimbursements?
I talked to a few people this morning, and I just tell them, get your invoice for the PPE together and to set aside so that way we can get reimbursed, and we have to meet with Gita to see what the guideline is. So it's really hard to say how much, guys. So like I said, this is all in the public. So we had to turn in to receive that makes sense for a lot of people. Okay, and it's not to and the guidelines is not to make money out of this thing. It's basically to make sure that you cover your cost expenses.
Yeah, I get it, Doc.
Okay.
You're just basically trying to recover the cost of having to exist and operate during this pandemic. So there's a lot of extra costs that you guys have incurred in trying to keep frontliners safe. And so just riddle me this, Doc. When you talk about reimbursement, if patients go to the clinic and they have insurance and you're getting paid from the insurance, what types of services would you then need to be reimbursed for? You're talking like PPEs and those kind of things?
But, it's just like, Christian, when you see people go through the clinical area, I can only speak for AMC, right? So whenever you guide them through, we didn't collect anything. It's zero collection. So basically, the whole day, that's what we do, is that if you come in sick visit or whatever you need to do because you worry about COVID, you go in and out the 4 doors in the back, and you didn't see anything exchange at all. So if doesn't matter insurance or not, we write it off and we just suck it up. So people have no insurance. We still see them. We still do the same thing everyone else. And like I say, there's no exchange of any way, any cash, anything like that. You get seen as a sick visit. And that's something we feel is important because we want to encourage people to come in when they're sick. So that way we can make sure that we catch them when they have COVID and isolate them. So the key here is see them, and not worry about money at that point.
Right. Well, let's move on to there was a physicians advisory group meeting last night, Doc. What was the majority of the discussion about?
We kind of get ready to start on one article of a writer to say that it's kind of insensitive for people to say that the people who pass away with COVID-19 that have comorbidity, and we really have to define that term. As a primary care physician, I have thousands of patients that have comorbidities with diabetes, hypertension, cholesterol. And if you ask them, are you ready to die today? And I tell you, none of them raise their hand. So, to have those comorbidity, yes, is a choice that you make because of the lifestyle. But the COVID-19 didn't give you a choice. One is to get on you, is to accelerate your death. And those people have many years of life with their family, but are taken away by COVID-19 because they have no choice in that one. It's not a choice that you go and buy a lot of food, buy alcohol. You have no choice. COVID-19 will affect everybody. It doesn't matter what age you are from. So I think that we have to, when you write an article, you have to be kind of sensitive to the family that lose the loved one so early, which if they don't have COVID-19, they can live many more years with their family. So just be careful what they write, and no one asks to die, even if they have comorbidities. It's something that you cannot control. This is an invisible, enemy that we have that you can catch it, at just one incident you can catch it. A patient that 65-year-old lady that she been at home and self-isolated for a long time, 4 or 5 months. She decided to go to one of her friend's house with the son of her friend passed away. And that one incident, she got a COVID and now she's in trouble. So, it only take one incident and she didn't ask for it.
Yeah.
So that's something that we probably try to report a different way so people don't put their guard down. Recently we have a young person that passed away, and that person have no comorbidity, zero.
Right.
So people wait too long to stay at home because they're afraid to go get care, and afraid that they were diagnosed to have COVID-19. So they wait at home for so long to the point where, when they get to the hospital, it's too late already. So
Doc. I mean, we've talked with Dr. Cabrera about this, and I just I agree with you. I think that to say things like, "Oh, these people were going to die anyway," or "Oh, well, you should have taken care of yourself." Oh, well, who told you to get pre-existing comorbidities? I mean, it's insensitive, first of all, because so many of our people these are genetic dispositions that they have. You know what I mean? And then also, you're right. Diabetes and some of these pre-existing comorbidities aren't necessarily always a death sentence. People live with and manage these the various afflictions. But what COVID does, you know, if you look at the science of it, is it takes the immunocompromised and it runs through and basically accelerates death. So what Dr. Cabrera was saying was you could have someone who could live 4, 5, 10 years with the conditions that they have. They get COVID and they're gone in 4 or 5 days, 4 or 5 weeks. It's not that hard to figure out, guys. It's really not that hard to figure out.
And, you know, it's a very lonely death, because when you die in the hospital, you don't have your family around you. And I tell that that's the hardest punishment that anyone can give to somebody. And you have to be sensitive. You know, if you have a heart attack and a stroke and you die, at least you have your family around you. But these people, there's a very lonely way to go, and you have to pay respect and you know, and feel for the family and for the patient. So I know it's a lot of people write things because of money and because of financial thing, and we understand that. But you got to be kind of sensitive to the loved one, the family. So that's all I can say. But we discussed about that and how to report it, so that way people pay attention to, hey, everyone can get it. It's not just the people that have comorbidity. Like I said, recently we have one that have no comorbidity at all, and it's young.
Yeah, we're talking about Rantamunda, who's the family said, yeah, he didn't have any comorbidities, healthy guy, good fisherman, gone.
Yep, that's gone. So it's affect people there, and you have to be careful, because we start seeing the past 3-4 days that there's a little spike there. You know, in the clinic we have increase in the sick visit, and I think people kind of been in this you know, quarantine for so long already. People kind of let their guard down because of COVID fatigue, and they expose themselves a lot more. They go to work when they sick, which they should not be. Okay, so and the message is, if you are sick, please stay at home. And if you are sick, then, you know, kind of stay away from your family, because, you know, we see patients who come to the clinic, car full of their family, and they test positive for COVID. Now the whole family will get it. So it's you got to pay attention to those things and protect your family at all costs. Okay.
Did you guys talk about the new quarantine policy? I wanted to ask you about this because you had been mentioning that it was going to be mandatory for people to have the Sarah alert. And so day 6, or what, 200 people tested out of government quarantine into home quarantine, and they don't have to have the Sarah alert.
Yeah, it will be mandatory once they get it online. I don't know I don't know what paperwork gets stuck at, but they should be implement the Sarah alert already. So just like I think
they haven't.
That, you know, once the Sarah alert is online, that they will have to go home with that with the Sarah alert on, so that way they can check in once or twice a day about the symptom. So, but the key here is the PAC want to really push this, the 7-day quarantine, and not wait for the Sarah alert to come on board, just because, you know, we want to push against the new quarantine so people can go home earlier rather than stay the 14 days. And sometimes we have to do that while we wait for Sarah alert to come on board. It should come on board the next week or two. I don't see why it takes so long. So, and I think it worked out so far very well. So, Sabrina, the public health and the quarantine team able to process all the tests within 24 hours. So they doing better on testing and get the test back on time so people can go home on time.
Right. Yeah, I think
so. They test day 6.
We did speak with Dr. Kaneshiro yesterday, and she had mentioned that they started testing on Friday. I want to say it's roughly about 200 people were tested that were eligible and met that 6-day requirement, and only 5 had tested positive for COVID-19. But I wanted to move on and see if the Physicians Advisory Group discussed or even had a reaction to the church's announcement that we're going to hold indoor masses. We've already reviewed, what we've reviewed, and we think it's prudent to do so, especially since we're going to be having these protocols in place. But there was something that Adelup said, and it was there's these church clusters. Can you tell us where these church clusters are? They want to know.
Okay, so
show us the information,
so we look
the data.
The top case where the cluster coming from. So we rank them by the most number they have. So the number 1 is the church. Number 2 is family gathering. Number 3 is the funeral. I forgot what number 4 and 5 is, but those are top 3 of the cluster we have. And the good part about is that the church cluster, at the beginning of the pandemic, when I think the church don't have a lot of control issue down, but I think that the church come up with very strict guideline now that I know that we probably feel comfortable even if the church didn't announce that they will open. More likely, we're going to open the church anyway. Like I said, we look at the data. Yeah, church have the number 1 thing. So what the governor does is she needs to wait until make sure that public health review every criteria that the church has put in place, and then they will open the church. But I think that more likely the church needs to be open for sure, 100%. So we just make sure that when people are sick, that they don't go to the church. They can stay at home with the car or something. That's something that we have to look at. If you walk in the church, have cough and cold, even if you have your mask on, you still have risk to spread out to somebody, because sometimes, the church, they get in the clothes, and I don't know. But it's something that we really need to make sure that the church have their own guidelines, which I think they have. Yeah. And make sure people attend the church know that if you're sick, just stay home. I don't think that's the main problem, stay home for 1 week to do that. So, and we keep an eye on it, but I'm very sure that the government will make the right decision, even if the church didn't announce that they're going to be open.
Right. I think the church already made that decision for her. But Doc, you said the church is the number 1. Right, the number 1. But is that data skewed at all by the large number of positives that we saw in the first wave from Iglesia Ni Cristo?
Yeah, I think that's something that in order for the community to understand, I think that public health need to release a number. They don't have to release the church, I think, because sometimes that's a question, the sensitivity on release a church name. But they can release a number of positives come out of the cluster, so that way people know that, hey, why they rank number 1, why someone ranked number 2. So what it is, they have the number, they have the church name, but to release a church name is not a good thing to do. But I think they can release a number, so that way public know that, hey, that's why we rank 1, 2, and 3, and 4, and 5. So that way we know where we need to concentrate when we open this space.
Anything
Answer
else?
your question, Sabrina?
Well, no, I want a list of the churches.
It's very hard. Sometimes it's not good. It's not good. But to the church credit, even if they on board that they have case in the past, that they take corrective action to fix it. So thank you for the church for doing that. So, like I say, at the beginning, everyone will make mistake, but you correct your mistake and to protect your person, then you be fine. Okay, but they took correction already.
Right, okay, so then this ranking that you gave us, was this based on the second surge?
Yeah, it based on the first surge and during the peak or two, the last peak or two and peak or three. So it based on the data in the past.
Mm-hmm.
I mean, well, how bad is it, Doc? I know you can't tell us what church is, but I mean, is it bad if they're number one? Because, I mean, they can't be that bad because you're saying that they should open 100%.
Yeah, it's a cumulative of all the church. Right, so it's not just a Catholic, it's not just a Baptist.
What's the number? Do you have a number, Doc? A number of cases that stem from the churches?
You know, we have the number, but like I say, let me be clear for public health. I think Ann Publicity probably the person that has to own the number. And, you know, I know she's on the radio, and I don't want to say a number that she say something different.
Okay, you know, let's just start with
I know.
Higher than 100. Is it higher than 100?
No, that's not higher than 100. I don't think so. I would say around the 40, 50 plus, somewhere around there. But I know Ann will give you a bigger number than that. You know, and remember, once you have a positive there, that whatever number is, the contact tracing will give you a bigger number, right? Because it's like a tree. Right. So you have 30 in one place, you talk about you might have 100 cases out there because that's 30. Okay, so just don't look at them out, but look at the way that the virus spread.
So church, family gatherings, funerals. So if this is the case, if these are the cluster busters, how come we don't see like fitness centers open? Or other businesses reopening?
You know, there's some positive there. And I think that as we, like I said, as we open the business, you know, we got to do it a little slow pace at a time. Just make sure we can handle that. You know, I said, I hope the number this week come down rather than going up. Like I say, I'm sure they're gonna open some more. It's just decide which one and you know, and what number they're gonna open.
As in, like, we're gonna know Friday.
I think you're gonna know. You should announce it on Thursday, so Friday you guys should know already.
Okay.
Okay, but we look at everyone. Like I say, every business should be open sooner or later, and like I say, they open a little bit of time. You see we concerned on the line at Ross the other day. When that picture looked, I don't know, that's too many people on standing in line. But I think people are eager to go out of their house. So we hope that that there's no surge or anything increased because of people's eagerness to go outside the house right now because they've been in the house for too long.
Mm-hmm. What about daycares, Doc?
That's probably the number one talk because we need to get people back to work because the children, and that's including the essential worker, the healthcare worker. You know, some people can go to work regularly. I have some staff that work from home, which is not the most productive thing because it's a healthcare clinic, because they can't find a babysitter or they can't find daycare. So it's affect the operation of any business if your staff doesn't have the daycare center open so they can put their kid in there. So it's a very important subject, and I'm sure that we're going to talk a lot more every day just to try to open those places so people can go back to work. Mm-hmm. Okay?
So probably not this Friday.
You'll be surprised.
Yeah. What if the governor just gets mad and she's like, you know what? Open the church, open the daycare, open everything. I could see that. I totally could see that happening.
Yeah, sometimes Chris, the pack will kind of slow that down. We don't want to be overwhelmed either.
Okay, Doc.
All right, thanks, Doc. Thank you so much.
You guys just if you're sick, just stay home, please. And then you sick, try to stay away from your family. And again, family gathering is number 2. So try not to visit your family. You have Thanksgiving going up. You have the Halloween going up. So try your best to not gather in the family. Okay.
Halloween, Doc. Can we do Halloween safely? Let me just ask you that. I'm asking for a friend.
It'd be a drive-by Halloween, okay? So.
Right. Well, I bought last night. I went to Payless and I bought me a little jack-o'-lantern bucket. There's a little light switch and you flick it and it glows because my mom sent a package and there was like Halloween candy in there. And I bought it and it was I was talking with the cashier and I was like, you know what? No, not Halloween, COVID. That's enough. You took Easter. You took, not Halloween. Anyway, Doc. Thank you.
Have fun.
Yep.
Be safe.
Is it okay to have fun, though?
It's okay to have fun in the family.
Okay. Thanks, Doc. Okay, bye. All right. 8:09. We got to take a quick break, and we're coming back with more of The Link on the Breeze 93.9. Good morning.
For DIY projects, the Home Depot's always in your corner.
GU Self-Storage.